This motion is carried. We will now move to the President's address. And it is my pleasure to introduce Dr. John Jevry. Dr. John Jevry is a professor of respirology, critical care, and sleep medicine with the College of Medicine. He graduated from the Mayo Medical School in 1991 and followed with fellowships in internal medicine and critical care from the Mayo Clinic, and a fellowship in respirology from the University of Manitoba. He joined the faculty at the University of Saskatchewan in 2002, where he's been active in collegial governance. He's been an RA delegate for several years and joined the SMA Board of Directors in 2017. He has also been active with the Canadian Thoracic Society and is currently on the board of the Canadian Society for the History of Medicine. Dr. Jevry, welcome this morning.
Thank you, Kishore. I wish I was as smooth as you are. I mean, he does that so well, and I don't even have any jokes to give you this morning. I'm sorry, but thank you so very much. Good morning, delegates, members, visitors. It's my pleasure as the SMA president to welcome you to our first in-person representative assembly in nearly 3 years. It's been a long time. It's been way too long. I feel that many of you are glad to be here and to see people in person once again. I know I certainly am. When I became president of the SMA, I wanted to have a chance to engage with physicians. I spent part of the summer, and we're going to have some slides slowly showing different places we've been. I've spent part of the summer traveling around the province, meeting with physicians in their clinics and communities. I also, this fall, along with Annette Epp, our vice president, traveled during the president and vice president's tour to many spots. In total, we went to over 30 different communities and clinics around the province, meeting people in your communities, hearing what your issues are. During my visits and discussions with physicians, I heard quite clearly that there is a crisis facing family medicine and those who work in primary care. I heard some physicians also speak about the challenges that they're experiencing with their interactions with the health authority. First, let me talk about our family physicians. Family practice faces some very serious challenges. There's really no other way to put it. It really is a crisis here in this province and around the country. In discussions with colleagues from other parts of the country, the various other provinces, some have even said that primary care healthcare system where they're at is collapsing. Those are strong words. Those are words that really cause concern for all of us here in this room and around the country. Increasingly, family physicians are unable to take on more patients. They struggle with their current patient loads. They cite lack of time that they can dedicate to the elderly and really complex patients. Many family physicians don't feel supported, and they believe that these negative conditions are pushing medical students away from going into family medicine. A survey that the SMA did in February found that 62% of family physicians in this province feel that they want to reduce their clinical hours, and 1 in 5 said that they were going to retire in the next 24 months. Other surveys of family physicians in Canada indicate a worsening mental health crisis due to the pandemic, as well as half of them are exhausted and burnt out. These challenges are not just about family physicians. It also affects specialists and the entire healthcare system as a whole. Physicians understand that substantive and meaningful change is required to sustain our healthcare system. Without transformative change, the viability of our healthcare system and our workforce is going to be compromised. Some of you may be aware of the Primary Care Compensation Working Group. This is a joint group, joint effort with the Ministry of Health, SMA, and also with collaboration from SHA. This group is signaling the necessity of a multidisciplinary healthcare team led by family physicians and compensation models that align with improved healthcare and health outcomes. The challenges facing us are complex, and the changes that we need to take to transform our healthcare system will take months, if not years. However, we don't have that amount of time to stop the bleeding. The time to act is now. Immediate funding is required to ensure some short-term healthcare sustainability, specifically targeted at fee-for-service family physicians providing essential primary care services. I recently spoke to the Minister of Health requesting exactly these kinds of change. I asked for some immediate investments to help with family medicine in this province. The fact that we need to act quickly if we're going to stem the challenges that are rising in family medicine. I've also asked the Ministry of Health to commit to collaboration on further transformational change over the next several years. This is essential to bring family medicine into the 21st century. I appreciate Minister Merriman and Minister Henley's commitment to healthcare in this province. For example, I believe that our profession is optimistic and thankful for the government's recent $60 million Health Human Resource Action Plan that was announced last month. The plan's 4 pillars, which include to recruit, retain, train, incentivize, and retain, are certainly ambitious, but success with this plan will be wonderful for healthcare in this province. This past summer, when I was traveling around the province, physicians often noted the need for nurses, for lab techs, and other healthcare professionals. These healthcare team members are needed to round out the healthcare team. Medicine is a team sport. Increasingly, it's very difficult for us to be family physicians or single docs running things on our own. We need the support of others. We need to work as a team. The government's healthcare resource plan will certainly help address some of these challenges. And I believe it's really apropos this week that we're having the National Healthcare Provider Week that we discussed some of these issues. Yesterday, Minister Merriman met with the board of directors, and we had a very good discussion. We talked about family medicine and how the SMA and the Ministry of Health can collaborate on solutions. I believe the SMA's message is falling on receptive ears, and I'm hopeful that we'll be able to make our way through these challenging times. I've also heard about the government's public commitment to accelerate measures to sustain and improve access to primary care. I sense that the Ministry of Health is seeing the value of these investments and the urgency, and this bodes well for medicine in this province. We will dedicate a good chunk of today's RA agenda to delve into these issues on primary care in more detail. In other issues, there is the issues as well with the physician's relationship with SHA. I recently met with Minister Merriman, the SHA senior leaders, and SMA leaders, and we had a meeting that resulted in a commitment to a more collaborative and mutually productive relationship with SHA. While progress is being made, I believe that physicians in this province are feeling less valued by the SHA than in the past. On your behalf, I've been communicating with the SHA the importance of having the SMA's input when they make any key decisions that affect physicians. The SMA continues to press on with developing bylaws that work both for the SMA and the SHA. The bylaws should be collaboratively constructed and need to improve our relationship working with SHA, having clear guidelines of how we work and regulations with SHA. The bylaws discussion is part of SMA's larger relationship with SHA. We're also in the midst of a number of complex and critical contractual discussions, many of which are difficult and lengthy. Be assured that the SMA has and continues to advocate strenuously on your behalf. I'm pleased that over the next day and a half, you will learn more about SMA's efforts in expanding physician wellness and supports for members. This is critically important given the level of distress amongst physicians. You'll also hear about the recommendations and considerations from the Special Committee on SMA Governance. As you may recall, this is work that the RA delegates asked us to advance at the spring RA. I want to thank the Special Committee members, all of whom are RA delegates that you selected and elected for this task. I want to thank them for all their hard work over the past number of months. And I look forward to hearing their report tomorrow. In closing, I want to thank all of you who are here today. Finally, we're in person. As delegates, you represent more than 2,500 physicians across this province who work hard every day for healthcare for the people of Saskatchewan. Thank you for your dedicated service. Remember that we, the delegates and members in this room, as well as the members outside this room, we all are the SMA. We aspire for healthy, engaged, and empowered physicians to lead high-quality healthcare and build healthy communities. Together, we can make our healthcare system better. Thank you again for all your hard work as physicians and physician leaders, and enjoy the RA. Thank you.
Thank you, Dr. Jeffrey, for your address, and thank you also for the hard work you've done to listen to physician voices across the province.